Hi, I'm Dr. Marty Becker, America's veterinarian. You've seen me on Good Morning America, the Dr. Oz Show, and here I'm today with this beautiful puggle named Sophie. And we want to talk about preventive health care. For a lot of people, preventive health care over the years has mean their annual vaccinations. Or they think, you know what, I'll save some money, I'll go to the feed store, go to that shot clinic and give that dog a little shot in the rear end, and that's all it takes for preventive care, and that's only a small part of what it takes to keep a pet happy and healthy. It's always much better to prevent problems than treat problems. So that's what we want to talk about, is the value of what happens when you take your pet to the veterinarian for annual or semi-annual wellness visits, and at which time will determine what, if any, vaccinations are necessary. In the past, we used to vaccinate every year, and now for a lot of vaccines, it's up to every 3 years to vaccinate. So you take your pet to the veterinarian, and the first thing they do is they listen to you to find out any problems that you've had with your pet. And then they do a tip of the nose to the tip of the tail exam. First of all, they're going to go up here and they're going to take the dog and they're going to flip its lip and take a look at its teeth. You often see them flipping the flap of the ear, and they sniff the ear, and they're smelling for yeast. And for a veterinarian, you can smell that like somebody smells popcorn at a movie theater. They're rubbing their hands all over the dog's body. They're feeling for any lumps or bumps. They're feeling certain areas for what we call the sentinel lymph nodes. They can tell if there's infection or even a tumor by feeling the lymph nodes. Then you often see them using their stethoscope. They're coming down here and they're listening to the heart. Listen to see if they can detect any murmurs. Has a nice strong sound. Oh, that sounds good, Sophie. Listen to how clear the lungs are. Then you'll often see them come up here and they're palpating in the abdomen. They're feeling how full the bladder is, feeling if the liver is enlarged. And they go all the way down to the toes. They want to make sure the dog's toenails are not too long so their feet are splayed out. They'll end up looking underneath there, seeing if there's any yeast or staph infections underneath their feet. So the value is to catch problems early on before they cause unnecessary pain, expense, or worse.